Hey guys, I'm Latricia Bennett. I'm the owner and nurse practitioner at IW Medical Spa in Cherryville, North Carolina. This is our Core Intima event. We are super excited to have you guys with us today for this. We're going to answer all your questions about vaginal rejuvenation. This is going to be from the privacy of your own home, which is great because you will be able to submit questions. No one will know who you are, and we will be answering those live. And if you do not want it answered live, we can definitely type in answers to your responses. We'll have Emily and Wendy manning those, and they can answer all the questions that you have. Now, we're going to have some great prizes if you stay all the way through the Q&A. We're going to have a free vaginal rejuvenation that we'll be giving away, number one, which is great. We will also have a few other prizes that we're going to sprinkle in there, but the big thing is we're going to have 35% off of this procedure all month long if you go ahead and book and prepay for it. All right, that will include 3 sessions of the interior and exterior treatments, which is huge. Okay, so we hope you enjoy our event. Thanks, guys. The Core Intima is a special laser. It's a CO2 fractionated laser, actually. What a CO2 laser traditionally is going to do is it's going to resurface and build collagen in an area. So that's basically what we will be doing with a Core Intima treatment. A Core Intima treatment is going to use a fractionated delivery of the CO2, which means that you're going to have areas that we are going to hit with the laser and areas that we don't. Because of that, it leads to a quicker healing process. Usually the downtime for this procedure, by the way, that is not painful, and even the downtime is not painful, but it's going to be a 7-day downtime. Within that time, your body is going to begin regenerating a lot of the collagen that has been lost due to childbirth, due to just normal aging, and even treating things like if people are having painful intercourse, if ladies are having stress incontinence, it treats all of those things. And we are actually able to tighten the areas inside of the vaginal canal as well as on the outside. If someone is having a lot of problems with, say, stress incontinence, we're able to tailor our treatment, and we go into those the vaginal wall area that actually supports the bladder, and we go ahead and treat that extra good so that you'll have hopefully immediate results with your stress incontinence. Although this is a 3-step process where you're going to have 3 different treatments, you should be able to tell a big difference after your first one. So with this treatment, again, we tell you that you cannot have sex or intercourse. You cannot use tampons within a 7-day period. However, at the end of that 7-day period, we feel that you will be able to tell a huge difference with the amount of collagen, the amount of blood flow, and as well as the stress incontinence. So the reason we purchased the CO2 Intima was basically we see a lot of hormone patients. We see a lot of weight loss patients, and especially with our hormone patients, one of the big complaints we were getting was loss of lubrication. As they were getting older, where people just weren't having a sex drive anymore and not having a great orgasm. So we can treat all of those with hormones. However, the Core Intima is a great adjunct to that therapy because what it's going to do is really dramatically, usually with that first treatment, help with lubrication. Okay, we're going to tighten everything up, better blood flow to the interior and the exterior, and that just leads to better sex, better orgasms, and again, lots better lubrication. Okay, so the areas that we're able to treat with the core intima. Number one, the interior, and we've kind of covered that. But number two is that exterior portion. So, you know, as we're aging, as we're getting older with childbirth, lots of times we have change in pigmentation. Okay, that change in pigmentation can be treated with the core intima. We're able to adjust those settings to target the pigmentation and make it bright, and you know, and just the color we've all been used to. Number two, we're able to treat the laxity there. Okay, so as we're aging, especially with those who give child, you know, who have vaginal births, you know, we do tend to end up having a little bit of laxity, okay? So the core intima, again, we're able to tailor that to where if you do have a lot of laxity, we're able to target those. You're usually able to tell a difference the first time, but a major difference after your third treatment. The ideal candidate for this procedure is going to be anyone experiencing any loss of lubrication, painful intercourse, definitely some stress incontinence. You know, all of those things are going to be treated with this procedure. The other thing that we really would love for you to have is a pap smear within a normal pap smear within the last 3 to 5 years. We will be doing a speculum exam prior to make sure everything's kosher, but again, we really prefer that you have that pap smear about 3 to 5 years, the normal one, before your procedure. Maximum results for this procedure is going to be after your third treatment. Usually, you got to think, if we're trying to stimulate collagen to an area, you're looking at about 3 weeks. So we generally tell patients, although many patients, you know, feel that they're able to tell pretty much immediately, you know, you're looking at around 3 to 4 weeks before you get the maximal effect. The results of this treatment are generally going to last you years. That collagen stimulation that you go through to that area is definitely, the area is always going to be better because of it. Now, as we age, we of course, you know, that collagen starts to go away again, but once again, the area is always going to be better than it once was. The great thing about the core intima is there's really not a lot of post-care. We generally tell you when you leave out of here to take it easy the day of the procedure. Again, we really don't want you to be having sexual intercourse or using a tampon for a good 7 days. Okay, but after that, you can resume normal activities. Hi guys, this is our treatment portion. So we have our beautiful patient here. We've already done our speculum exam. And now we're going to go ahead with the internal treatment. Each one of these little wands are disposable. So we're opening that up now. Now Emily's going to go ahead and put a little bit of baby oil on it for comfort. And then we're going to attach it. This is the quickest treatment ever. Okay. Just a little bit. And so we'll go ahead with this treatment. We're going to finish the first portion of our treatment. I do want to check with our patient here if she has any stress incontinence. If she does, we're going to change the treatment just a little bit for that. Jennifer, do you have any stress incontinence at all? Okay, perfect. We're able to focus a little bit more with stress incontinence on the area of issue. but she doesn't have that problem at all, so. Okay. So Jennifer, if you would just relax your legs outward.
Mm-hmm.
I'm gonna go like that. Yep, relax outward. Okay. And then you're just gonna feel me touch. Alright. Take a good deep breath. And out. Okay.
Mm-hmm.
So then we just sound the vaginal canal.
It's fun.
You okay?
Yes.
Any discomfort at all?
None.
Perfect. And then you're going to feel the first pulse. Okay. How was that?
Perfect.
Did you feel anything? Was it painful?
I didn't feel anything.
Wonderful. Anything?
It feels. No, it's good. It doesn't hurt at all.
Wonderful. And what we do is we just treat each area of the vaginal canal, each section. It's very quick, minimal discomfort.
There's no discomfort at all.
Good. You okay, Jennifer?
Yes.
You feel anything at this point?
No, it's comfortable.
Okay. When we get a little bit more towards the introitus, she's going to feel it a little more.
I do.
Yeah. All right, and that's it.
Wow.
All right. All right, so that portion's over. You can relax, Jennifer. And we'll go ahead and prepare for our external portion. Hey guys, so now it's time for the external portion of our treatment. The internal took us, 5 minutes? It wasn't very long at all. Minimal discomfort. We numb you a good bit for the external because it can be a little spicier. So with our patient here today, there can be different reasons that we're doing the external treatment. One could be discolorations, the other could be tightening and a little bit of laxity. Well, so for this patient today, she just has a minimal laxity. She delivered her child through C-section. Those of us with vaginal births, we have a little bit more laxity down there. But Jennifer has minimal. She has a little more discoloration around certain areas. So what we're going to do is we're going to take our one mode that is going to focus on the laxity issues, and then we're going to go back with another mode, and we're just going to focus on those discolorations. This is also going to be a fairly quick treatment. So here we go with this one. Okay. Jennifer, you just let me know, okay? Here we go. How we doing? Good. How's that feeling to you?
It's fine.
Okay. And that is it. Very simple, quick procedure. We get you in a little bit early to the office for numbing, of course, but then the entire treatment time is well less than 30 minutes, probably like 15 to 20 minutes, I would say. And Jennifer, how did you do? How was your procedure?
I felt zero pain. It was very comfortable.
She should really be able to tell a difference usually within a week's time. Okay, but we'll check back with her and see how she's doing in about a week. Thanks, guys. Thank you guys so much for attending our event this evening. Winners are going to be notified via text or email. Okay, so watch those. You're going to get a text message at the end of this session, so make sure to respond yes to book an appointment or a consultation. And lastly, we're going to have some great Q&A coming up for the next 15 to 20 minutes. So please, guys, stay and take part in that. Carry on. Hey, everybody. This is our Q&A portion. So if anybody has any questions, we're ready to answer. Hey, Joni. Does it, wait a minute. So, okay, so I have a question here. Does the pink come back? I have dark areas in the labia area due to hormones. Yes. So that's what we use there's one of the treatments we can do, the superficial treatment that that's going to help with any discolorations that are there. And yes, the pink will definitely come back. Okay. So how much is this procedure? So this procedure includes, what we're doing for this event is we're including the internal, we're throwing the external treatment in along with the internal. So really just the charges for the internal. So for those 3 treatments, the sale price is $1,365. Okay, so then there is another question. If you've gone through menopause, is this good to do? Actually, that's one of our, our main focuses with this treatment, is because you do have so many changes with menopause. The area gets a lot drier, and that dryness is treated very nicely with this procedure. So yes, it's actually a very good idea for patients that have gone through menopause. So let's see here. Okay, and then another question is there any bleeding or cramping after the procedure? So there's actually not. I personally have had this procedure done, and there was no pain after the procedure. Actually, no pain during the procedure, and no cramping either. I don't think we've had a single patient complain of that at all. And then the next question is how many sessions? So this is usually 3 sessions. With the interior and the exterior, we do 3 sessions for almost everyone. And then let's see, how long does it last per se? So this treatment is just like any other collagen regeneration treatment. You are going to always be better for it. Like you're, a lot of if you're having issues there, it's going to get much, much better. And then as you age and years later, you're going to start to see some, not really problems start to develop, but you're going to see it, slowly going away, but usually years. Okay, another question is, as I've gotten older, I've noticed less orgasms. Will this procedure really help with this? Yes. And so you got to remember, we're going in there and we're increasing the collagen and the blood flow. So that increase in blood flow is going to dramatically help with any, loss in orgasms. It should actually make sex much better. Okay, I have severe incontinence. Does this help with that? So, it does help dramatically with stress incontinence. Like if you're having severe incontinence, I'm going to say it's going to help, but it's not going to completely get rid of it. But for most people with stress incontinence, that's mild to moderate, you can tell a huge difference even after the first session. And we're able to actually tailor it. So if that's one of your main issues and problems, we go in there and we treat that portion of the vaginal wall extra, we go back in and treat it again so that we can help that particular issue. Let's see. Pay the cost full to get the discount, and that's a yes on that. So you continue. Okay, so one of the questions is you continue to use your vaginal cream. So I'm going to say yes on that, because a lot of the times the combination of the two therapies, like just with anything with our face, a combination of the two therapies is going to work better than just the one. Okay, and then how long before improvement of the lubrication is noticed? So we have had patients say that they can tell within a week's time that they're seeing a difference, especially with the lubrication issue. And we've even seen patients say within a week's time that they can tell a difference with with their orgasms and their sex and things like that as well. So no, insurance does not cover this procedure. How long between the 3 sessions? So we usually say 4 to 6 weeks between each session is best. Let's see what else we've got here. I think we've about got all of them. One of the questions is, what is the downtime from exercise? You don't really have any downtime from exercise. We tell you the very first day to go ahead.
Sorry, your video cut out. Everyone, just hold on 1 second and we'll come right back. You might have to move a little bit.
You want me to move, Diane?
Or, I'm going to remove you and then just click participate again, okay?
Hey, guys.
Yes. Sorry, everyone.
Sorry. Had to move around this old building. Let's see. I don't know if you guys heard, what is the downtime from exercise? There's no downtime from exercise. The day of the procedure, we like you to take it easy, to go home and kind of relax. But other than that, you can resume normal activities the next day. And yes, we do accept HSA cards. It does seem amazing. It is. Okay, so yes, 3 treatments are required. That's going to give you the best results. We have had, there's been one particular patient that just wanted to do 1, and so you can do 1, and you can see if you can tell a difference after 1 treatment if you'd like. So absolutely. How soon can we book? You can actually, you can go online and book. You can call the medical spa tomorrow and book. So we're already doing these. So you can book anytime you would like. So are baths or swimming? This is a good question. Are baths or swimming prohibited during the week after? Yes. So during that week after, again, no sex for a week, no tampons, no douches, and no swimming. So right now is the perfect time to do it. Oh, yes, they reminded me. Okay, so this is one of the things you want to make sure. You want to book this appointment when you are not menstruating. If you're menstruating, you're just, you're just not going to have the best results. So we would like for you to plan ahead for that, for those of you that can.
Does the price include 3 treatments? Yes, ma'am. And it is, again, we are throwing in the exterior portion on, on this deal. So we're doing the interior. It's really just the price for the interior that you're paying. Okay, so yes, actually, one of the questions is, so can you have outside stimulation to the clitoris during those 7 days? And that is a yes. And no, there's no issues if you have an IUD. Let's see, I want to make sure that I got everybody. Let's see. You guys got any more questions? Oh, wait a minute, let's see. I do have one more. Hold on. Where'd it go? Where'd it go? Change in the appearance. Okay, so this is one of the great things. So any after childbirth, everything gets a little loose and lax down there. So you're going to have a dramatic change in that exterior appearance after this. We use there's a mode on our CO2 that targets the laxity. So we go in there, we target that laxity, and everything is much tighter than following those 3 treatments, like dramatically tighter. So the appearance does change dramatically. Any dark areas should be gone. And then again, the laxity in that area should be, like in the labia particularly, that should be nice and tight again. Yes, in hysterectomy patients, that is, you're going to, you may already be seeing some changes down there from the hysterectomy, and that can help resolve those issues. Again, we will do a speculum exam prior to your first treatment, just to, I'll be doing that speculum exam. So just to make sure everything's okay down there. We don't want to do anything that would hurt anyone. So we will just check and make sure. Okay, so if there are no more questions, just remember that if you book and prepay by the end of the month, you get the 35% discount and the exterior treatment for free. And you are going to get a text message at the end of the session. So just make sure to respond to it. And I am so glad you guys came. Thank you so much. Bye, guys.